The United States has one of the best healthcare systems in the world. However, many African countries are struggling to build their health sector. The journalists on the media tour by the U.S. Department of State's Foreign Press Center visited the University of Tennessee Health Science Center in Memphis to grasp what is the determinant of America's strong healthcare system. Welcoming the team of journalists, Director of Center for Multicultural and Global Health at the medical school, Dr. Denis Forestier, emphasized that investment is key for Africa's healthcare system to succeed.
In 2005, there is what is known as the Abuja Declaration, where health ministers from sub-Saharan from Africa, they met in Abuja and they decided that in order for healthcare in Africa to really be where it needs to be, African countries need to invest at least 15% of their annual budget to health. I would say there are probably two countries in sub-Saharan Africa that have met that target, and it's close to 20 years since the Abuja Declaration. Most African countries spend less than 7% of their budget on healthcare. So the amount that is invested on research and development, on R&D, is usually less than 1%. Now, how do you advance when your amount that you're investing in research is very small and you have major constraints?
Leadership holds the key. Visionary minds, both in government and medicine, must forge a resolute alliance. For instance, Sierra Leone's health policies are to be shaped in a more vibrant way for resources to flow in addition to the 11.6% national budget already being invested in the sector.
For countries that are having the opportunity to build or rebuild and have resources to do so, I think the importance of creating good access to care and access that is equitable across all populations and across both rural and city areas is really important. It is very hard to build the healthcare system. Some of our students have the opportunity to have international experiences, and there's an interest in that because that broadens their horizons also.
It is clear that innovation lies at the core of the university's training ground. A correlation of cutting-edge technology harmonized with the training of compassionate medical personnel. These hallowed halls resonate with the echoes of progress as science and humanity intertwine. With a dedicated leadership, it is possible for African countries like Sierra Leone to develop standard training facilities for the next generation of medical practitioners.
This is to teach people actually how to protect somebody's airway to help them breathe if they're in trouble. We have a similar version of this that teaches people adequate cardiopulmonary resuscitation. And what I talked about in the previous room, where there are companies that go all over the world and teach people basic life-saving skills that wouldn't have had that opportunity otherwise. The company that I'm referring to that has a footprint all over this world has done this work where they're teaching people in low resource areas how to do resuscitations of newborn infants and how to do life-saving techniques for mothers in delivery that may have bleeding or an issue that happens in delivery that otherwise, if they didn't do the simulation-based training, they would succumb to and have really changed the mortality of women and children.
Learning from standard medical practices, this is how a teaching hospital should be. And the biggest recommendation to Africa is to invest in the medical system. Salivu Nakamara, AYV News, Tennessee, USA.